Without further ado, I'd like to introduce Bill Cioffredi again. Bill.
Thank you, Stephanie. Dennis, thank you so much for taking the time to come here and speak. As you were talking, I didn't totally have my philosophy piece lined up for the joint health part, but it certainly is where my head is at on a lot of what we do and seeing how things have changed in our culture over the 37 years that I've been practicing. So I would just make an initial comment that from my own viewpoint, it really is our mental wellness that may be the thing that is not in as great a shape as we tend to be looking at people from a physical standpoint here, the kind of work we do. And it's more of what I've seen over time, that more and more of the people that we see have some history of anxiety or depression or panic disorder that I had ever remembered in the earlier times of my career. So if we do anything well in our clinic, as we deal a lot with the physical aspects of things, we really try to help people develop their confidence in their ability to take care of their physical aspects and their confidence in their ability to take care of themselves. And if we've done anything at all that allows them to feel more at the cause of their life and not the effect, that they can live their life more on their own terms, then I think we've helped them in a bigger way. So that's probably my philosophy part, Dennis, and I'll move on from there. So when we look at optimizing joint health, I'm just going to talk about it from the standpoint of, well, what is suboptimal joint health, which is really osteoarthritis. So looking at the prevention of it, or the delaying of it, or the management of it, when we think about that. So the bad news is if we live long enough, then all of us are going to have osteoarthritis somewhere in our body. By the age of 60, almost all of us have evidence of that on X-ray or MRI somewhere in our body. But the good news is that osteoarthritis doesn't necessarily mean it's symptomatic, or it doesn't necessarily mean it's painful. The example just this week, a woman who was having an X-ray for checking out if the fracture in her hip was doing well and if the rod was in place. She said, gee, they told me I have terrible arthritis in my back, but she's never had any back problems or any back pain at all. So she's had the arthritis for a long time. It's not been an issue. And the other is that movement and activity is helpful, if not essential, in the prevention or the delaying or the management of osteoarthritis in the sense of maintaining optimal joint health. So there's another example of a gentleman I've had the pleasure to work with over a few different times over many years. He's now in his 70s, and in his 20s he had a back injury and had surgery. He had a fusion in his back, so that was back in, we'll call it the older days in the sense of the sophistication of back surgery. So he's had to manage the condition in his back, and he's done so very well. The interesting point this time, he came in and we were working and getting whatever symptoms were there back under good control. And he says, you know, the problem for me this time around was that I was in a situation where I couldn't do my usual walking. I said, well, what's that? He goes, well, I usually walk an hour every day. And when I walk an hour every day, I don't have any back problems. So I thought that's just a great example for us all in the sense of walking being very important and helpful. But the other interesting part was that he has terrible arthritis in his knees. And he described, yeah, they told me I had bone on bone. And yet, I said, well, you know, how do you do walking for an hour? He said, that doesn't bother my knees at all. Now, this gentleman doesn't necessarily go up and down steep inclines and go some vigorous hiking up and down steep inclines. So he does things that work well for him and stays quite active on his own. So the other key about this is what is a beneficial activity for you, because this is really an individual issue. So arthritis is very prevalent in the United States, and it goes into some detail about the number of joint replacements. This is in 2011, tremendous number of knee joint replacements, hip joint replacements. This doesn't even refer at all to spine surgery, which oftentimes is done for reasons of arthritis, and shoulder joints. So it's very prevalent. We wear our joints out a lot. There's a lot more numbers than there were now in 2011. So just understanding basically about osteoarthritis, and actually, Ruth, there's a model on the back, if you wouldn't mind walking that up to me. Yeah, I forgot that. Not one, yeah, bring both of these please. So osteoarthritis is really a problem of disease or injury to the special shiny cartilage on the end of our bones. So if you get a soup bone and you look at a soup bone, the end of the bone is white and shiny. That's the way it should be, white and shiny end. That's not bone really, that's a special cartilage. It's very slippery and it allows our joints to move with hardly any friction. So when we start to wear that stuff down, that's when it starts to create some problems with how the joint works. And as you see in the picture, there on the left, there's a lot of space in between, and there's some space in the knee joint because there's also a different kind of cartilage in the knee joint. But all joints have space between, even if they don't have that other kind of cartilage in the meniscus, because that white shiny stuff doesn't show up on x-ray, so there's space when it's normal. So you see on the other side, there's not much space. That white shiny stuff that's very slippery has been worn down. And so that's looking at, you can see kind of the divots and how that part of the bone is worn out as an example of osteoarthritis. So there's a few influences on it that are helpful to know. One is the genetic influence. Some people are a little more prone to having problems with their joints or muscles, just like some people might have a little more trouble with their cholesterol. Probably the important point I'd like to bring out is there are people that are older who still can accomplish tremendous things physically. There's a woman in the Upper Valley who, she's not 80, she's pretty darn close, who continues to compete in triathlons, and she usually wins all the time because of her age group. She's really an exceptional athlete. And from that age, but even younger, there's oftentimes a tendency for us to look at sometimes at what people have accomplished and think that, gee, it's just a mental thing. If we just are just determined enough and diligent enough and disciplined enough, we could do that or something like that. Maybe the case, or maybe that there's some genetics involved that is a different issue. The traumatic influence is simply that if you were to break a bone, like your thigh bone, and the break goes into the joint where that white shiny cartilage is, it damages the cartilage, and so it's predisposed to wearing down if you have that kind of damage to that. And then the daily loading influence is really more of what we want to talk about today, because that's what some of the big decisions are for each of us about, well, what kind of activity, what kind of loading is good and right for me. So here's the master slide. This is all the answers to all the questions. So take notes, except for it's a bit generalized, and the key is the specificity. But move. Movement is the key to the health of this kind of cartilage, and it's the key to just our general health in getting fluids to move, fluids in the joint moving for the lubrication of the joint, and all our other fluids that make things happen. So we tend to have a sedentary lifestyle in our country. In technology today, There's a lot of reasons to watch Netflix or look at the computer and surf the web. There's so much information at our fingertips and other things like that we may not be moving as much as we could or should. So the movement is fundamental to the health of cartilage and maintaining good joints. Relaxed, erect posture. So I just have to make a comment. I was watching an old movie with Cary Grant the other night, and I hadn't seen movies with him in them much before, but I just remarked that this gentleman just standing tall and relaxed, and he was moving up and down stairs. It's like Fred Astaire, and that just a way to carry himself with ease and fluidity. So posture is a reflection of some things that really affect the joint health that I'll mention in just a minute. But utilizing erect posture is only good for our health. So maintaining joint motion is really important, because if you can imagine a joint that starts to lose its motion and you start to operate in a small range instead of a big range, it means all the load that you put on the joint now gets put in a small area. So that's where it's an issue where it'll start to wear that cartilage down in certain spots because you don't use the full motion that you should have. So maintaining our joint motion is really important in managing and preventing this kind of problem. Flexibility is another thing that's similar. When we talk about flexibility, we think mostly about muscles. And so if we keep the length of our muscles, so our hamstrings, can you bend over as if you're going to touch your toes, how flexible is the back of your thigh? So keeping the length of our muscles also allows our joints to move fully, and so if we lose that more and more, then it's going to load the joint more. That's another thing that contributes to it. Same thing with strength, is that strong muscles absorb energy and dissipate loads. Flexible muscles and strong muscles absorb energy and dissipate loads. So while there is a natural loss of some of our strength, things like that, as we get older, studies have showed that a lot of people lose a lot more of what they have in capacity because they're sedentary. And the studies show that people that do some exercise and training, even for people in their 90s, have the capacity to increase their strength substantially. So maintaining what we have is fundamental in our joint health. Minimizing excessive forces is an issue of certain activities are easier on joints than others. Some people can participate in triathlons and not have it bother their joints. Many of us, things that are concussive in nature, jogging and playing tennis and those kinds of things, might be a little more difficult. It doesn't mean that people shouldn't be playing tennis as they get older. It's just that different people are different. Their anatomy and genetics are different, and also what they've done to keep themselves in shape might be different as well. So increasing activity and exercise on a gradient is probably one of the biggest things I suggest you think about when you think about activity for yourself and what you'd like to be doing, because as we exercise, whether it's activity, and increase that steadily, our bodies get used to that and adapt and adjust and get stronger. The bones get more dense, the ligaments get more dense, the muscles get stronger. If we do that a little bit and then we are sedentary and then we have a big rush, like springtime comes one day here in the Upper Valley, and all of a sudden we have 3 weeks worth of gardening to do, then that's the big challenge if during the winter you really have been relatively sedentary. So use it or lose it. An example of posture here. So if we spend long times in postures, sitting for example, if I'm sitting in my tissue adapts in the back of my neck, where I lose some of the length of that. That's as far as my neck I can go. If I have enough mobility to be erect, then my neck can go farther because of the geometry. And the same thing with shoulders. If we're rounded and over time our tissues adapt because we haven't maintained our flexibility, that's as far as my shoulder will go. But if I stand erect, the geometry changes and allows me to move my arm farther. And you can see in the picture, if you can imagine tight hips, because a lot of joint replacements are hip replacements. If the muscles and things around the hip gradually shorten and adapt, then that ends up loading the joint a lot more. So maintaining muscle length and flexibility. As Dennis said, I didn't talk to him about his little talk before he mentioned about walking, but that is, I'm in total agreement with that. It's so important. So this is a great picture from my viewpoint, from the standpoint of the woman in blue especially. You can just see the amount of motion that's taking place in her body. The torso is rotating, so the spine is rotating. You don't appreciate how the hips move, but they have to turn in and turn out when you walk like that. So it's maintaining that motion. One leg is all the way back, one is out. So it helps to maintain the length of that, and it provides the lubrication and those things needed. So it's a great exercise to do, to keep going. So I have a few pictures of a few exercises that would be just examples of, how could you keep some things moving if you weren't doing it just through the activity itself. So this is obviously someone who's 25 can move a little bit farther than some of us here in our clinic, but rotating the legs towards one side, they don't have to go all the way you see in the picture, but head one way, knees the other. Yoga is a very popular activity to take part in, and it can have some great benefits. This is doesn't seem very complicated, and yet in this particular pose, it requires the hip joints to move one way in one leg, a different way in the other, and helping to maintain some of that mobility through the hips. The thing about yoga is that there's not many guys in the yoga class, right? So guys, we have to find another way to either do our yoga at home in our own room or something so that we keep our mobility. Very straightforward movement, but this is a way of keeping the hip joint and the knee joint flexible. So people can do this before they get out of bed, but it's use it or lose it. If you don't, it's like you wake up a decade later, it's like, oh, I can't bend my hip all over. So we often tend to lose movement in our back, and it's usually because we don't use it. So maintaining that is only through certain movements a lot of times that we maintain that. The picture on the right, the person's really maintaining the full length of their shoulder motion, and it also stretches muscles that we have that attach to the shoulder that go all the way down into the mid and lower back. This is stretching hamstrings. So this picture is an example. Again, the hip joint is such a common joint that we lose our motion at. That just allowing the knee to fall out and encourage the joint to move, the hip rotation. Maintaining that, or even gaining that. There's a woman that I'm working with momentarily who's in her 60s and is heading off to Spain to do some horseback riding over there, and came in, and she's got osteoarthritis in the hip. And she's gained about 20 degrees in her hip motion because of specifically working on something that she didn't really know she had lost, or how do you actually deal with that. And this movement is one example of how do you keep the hip flexor muscles long. Those are the muscles, if you sit, you put them in a shortened position, and if you don't do things that keep them long, then they will shorten, and you end up with a joint that you only move in a smaller range. And there's an exercise for the shoulders, for the rounded shoulders. So strength is really important in maintaining joint health. And squatting exercises are something that historically, they were like, oh, we don't teach people to do squats because it would aggravate their knees. Well, fortunately, we learned that, well, if you can't, do a movement like that, you're going to have a hard time getting up out of a chair or going up and down stairs. So my point isn't that everyone should get up and do a gazillion squats, but it's a movement that's used with everyday activities, and maintaining the strength in our thigh muscles and our hip muscles is really essential. A lot of people that have arthritis in their knee have lost a lot of strength in their thigh muscle on the top. And restoring that, a lot of times, is very effective in reducing or eliminating the symptoms they have in their knee. So this is just an example of how things move along in a more advanced movement. That's kind of a lunge movement there. And then the other one on the right is a plank movement. So there's movements that can be challenging for the right people at the right time. There are some movements that would be strengthening that this would be really outside of someone's ability. That would need to be done a different way in order to gain strength. So it is a bit of an individualized approach with people to do what things really are appropriate for their particular situation. So the idea of building things up gradually is really fundamental to safely being active with your joints. And so if we think about, hey, what's the limits of the physiological limits of our body at a given time, because it changes, it can change. We want it to change and make it bigger, right? But the strength of the muscles, the flexibility of the muscles, the density of the bones, the density of the cartilage, all those things, the ligaments, they respond to mechanical loading and stress. And it's a matter of stressing those near our limits, but not beyond our limits, that allows our body to adapt and increase our strength or flexibility if it's done correctly. If we push beyond those limits, then we start to have a breakdown. So the frequency of an activity, how long you do the activity, the intensity would be, hey, do I go out for a walk that's on Mount Tom out there that's a little kind of leisurely up and down, or am I going to hike something pretty steep in the White Mountains, a different intensity, and having adequate recovery. So we have a great day of exercise. It can be great. I work for 2 hours in the garden, kind of sore afterwards. Do you have enough recovery time, whether it's a day or 2 days, that things get to calm back down before you go back out at it again? So I'll give you an example of a gentleman that I just met last week. He's early 60s, and a tennis player who had a problem a year ago. Played 4 sets of tennis, and after the 4 sets of tennis, played a round of golf with his wife. And he said, yeah, my back got really tired, and by the time I was playing the round of golf with my wife, I got to a point where I actually couldn't straighten up. And couldn't straighten up, and his back didn't get better. He didn't get better with medication, didn't get better with injections, ultimately had surgery. That didn't really fix it. So he's in the clinic now, and he's improving. Actually, he played a half hour of tennis for the first time in a year by trying to address limited mobility of joints, things like that. But the point is, there was way too much frequency, way too much duration, way too much intensity, and not enough recovery. And whatever arthritis he had before the incident, he just took that and he flared it up. So some basic signs of excessive loading. You have pain that results in limping or limited movements, like, yeah, I worked in the garden, it's like, I can't get my arm over my head now. Well, that's just one indication that it might be a little excessive. It doesn't mean you should have to stop. It might be, make sure you have adequate recovery so that you don't go back and like, yeah, I know, and the grandchildren children are coming, and we just have to finish painting the bathroom before they get here, so that you add something on to something else, and then you flare your joints up, and then you have a problem that doesn't always go away as quickly as it came on. Increased pain or soreness that doesn't completely return to baseline. So, I mean, it'd be nice if we didn't have any pain at all, and we all had, hey, I don't have any pain. If I go out and exercise, I might get some soreness, but the reality is some of us have some areas that are always a little, some level of discomfort. It's a matter of if you go out and do an activity that increases that substantially, you really want that to be able to recover before you go out and really hit it hard again. Whether it's gardening, hiking, whatever kinds of activities you're looking at. And then certainly if the activity results in increased joint swelling, that's just another indication that the joint is really getting irritated. So don't stop everything, just modify. Relative rest. It swells, ice. This is up here simply that there's a lot of different kinds of activities and exercises that can be great for us. It's a matter of what degree that we participate in these different things. Whether it's yoga or Pilates, TRX, they can be very good, but some movements and some classes can be outside individual limits. So you know what your limits are. And cross-training was not that we all have to be cross-training here, but the cross-activity. The body likes movement and it likes variety of movement. So if we do different things with our bodies, that's great. These are examples of some pretty high-level things that maybe in the TRX class, like, yep, may not be for all of us. So in absorbing energy and dissipating loads, proper footwear and proper surfaces are an element. So whether it's, hey, we're an artist and we're standing, we're doing watercolor painting, or we're walking, hiking, proper shoes absorb energy and really help us out with that. Some people can go for long walks if they're on the track or on the rail trail. They might be able to jog on the rail trail, but if they go on the pavement, the joint doesn't take it. So the footwear and the surfaces are key elements. Sometimes for treatment for people that have symptomatic arthritis. This is an article in 2005 in the Physical Therapy Journal that looked at people that compared to people that didn't do anything, and people that received exercises from their physician. It was just a handout, hey, this is your home exercise, go do it. And then the other group that had some hands-on physical therapy that was either stretching the joints, muscles, and also a clinically supervised exercise program. Both groups, the exercise group and the physical therapy group, both improved. The exercise group improved on a certain scale called the Womack scale score. 26%. Physical therapy group improved 52% within the first month. So it doesn't mean everything can cure cancer, but it's an indication that things can be done to help arthritis symptomatic for people. And even a year out, these gains were still existed in that study. So at our clinic now, since we moved here 2.5 years ago, we added medically based personal training to our services. And part of the reason we did that is because we might work with someone to help them get over an arthritic condition in their knee or their hip or their back, and yet they still have the capacity and they have the interest to really do more and to gain more ability to do other things they wanted to do. And the medically based personal training for us was a way to help address the individualized needs of people to help them achieve what they wanted to achieve, because it's not quite as simple as these are the principles there, you just follow the principles. It's really something that may require some individualization to it. So I'm happy to take any questions. Yes?
Your opinion on the use of drugs in mitigating joint pain?
There's two sides to that one. So yeah, the question is my feeling about anti-inflammatory medication. Anti-inflammatory medication in the sense of helping joint problems. There are some people that I've treated who prophylactically just always take 2 Advil in the morning, 2 Advil at night, and they do that because they feel it helps to prevent them from getting worse. Well, people oftentimes think about the bleeding ulcer that I don't want if I take some of that kind of medication or liver problems that might show up. It also has a tendency to interfere with our absorption of nutrients in the gut. And actually, Amy, she may speak to this as well. And so I think that if people don't need it to feel well, it's better to not take it prophylactically. And yet, there is a place for us, I think, in our field where sometimes it may even be a window. The person needs a window of time that calms the joint down so we can help them with other movements and exercises that can then be their body's way of managing it. And then there may be an element where, hey, I don't need it, but periodically when I'm going to do more, I need a little help. And so they use it sparingly. So I think that there is a useful place for it, but I would try to avoid regularly using it, especially if it's just prophylactically, because there's some of the negative effects. Yes.
How about glucosamine control?
Glucosamine control is something that is a supplement that some people take for joint problems or muscle problems. And over the course of my career, there's people that have taken it and said, you know what, I'm on it, I'm better. I went off it and I felt worse. I went back on it and I felt better. And for them, it's proof positive that it was valuable to them. The other people, they have not noticed a difference in the research that they try to do on it. There's no research that really indicates strongly that it does a specific thing. I'm a believer, and it's like, well, if it works for you, and it doesn't have really any side effects, and that doesn't have any that I'm aware of, then I'm
When we get older and retire, we rearrange our time on what time we spend for what. Now, is there any indication on your side that as we get older, we need to spend more time on exercise than, say, if we were 50 or 60 years old? To be practical, should we aim at 70 or 80 to exercise 2 hours a day instead of 1 hour a day when we were 50? I think that's a very important part. And of course, the backside of it is if you exercise more, then we get tired, and you say over-exercising. So what is your experience? What's a good middle road?
Well, that's a really good question. Making it tough on me. This gentleman is a gentleman who actually cross-country skis across Norway, is it? Finland?
What's that?
Wait, what's the country that you cross-country ski across the entire country?
Finland.
Finland, yes.
Yeah.
It used to be yearly.
That's something I can't do anymore.
Yes.
Well, it's a bit too slow.
So he's the person with the genetics that you go like, some people, they have it. That's a great question that you have. Nice. And I think the concept of movement is really important. So it doesn't necessarily have to be exercise from the standpoint of, I got to go to the gym, or I have to do. But there are people that you'll talk to, and they'll say, well, I'm pretty busy at home. I rarely sit down. And then there'll be other people in their 50s that they spend most of their day sitting, whether it's at the office or doing email or surfing the web or watching television. So, and that's generally, it's just not very healthy to be sitting for long periods of time like that at any age. So I don't have an exact answer on the amount of time, except that keeping your body moving, it doesn't have to be a formal exercise or that you have to put 2 hours aside, but it does having some relative rest in between so you don't get overtired, so that you're re-energized again. Are you re-energized? Okay, if you are, you're getting enough relative rest. keep going. I'm happy to talk with you further afterwards if that didn't quite answer. So how am I on time here?
And one more question.
One more question?
Yeah.
Okay. One more question. Yes.
I have just a simple one. You talked about ice being a good remedy. How about heat?
Heat is something that we have people use heat for different joints. Especially if the joint is more stiff than it is swollen. If they overdid an activity and it's swollen and it's really painful, then we would not tend to use heat. Because people tend to draw blood to the area and then it just kind of stays there. It doesn't flush through. Ice will cool the temperature. It provides a bit of a temporary anesthetic, so if it doesn't hurt quite as bad, you might tend to move a little more naturally, and the natural movement is therapeutic on getting the blood to flow through in the movement. And it also creates a reflexive vasodilation, so like when we go out in the cold, the cheek turns red because the body's trying to warm the area up. And so when you put ice on, it first cools it off, but then the body rushes blood through the area that brings in oxygen and nutrients and takes out the waste products, so it creates more of a flushing effect. So when you're really overdone it, it's really sore or it's swollen, the ice is really appropriate. But those times it's like, I'm stiff. I'm stiff and just kind of sore. Hot shower feels really good. That would be where the heat is very appropriate. Good. Well, I'm happy to talk further if they have any individual questions afterwards, but I'll save time for Amy. So